second leading cause of male cancer-related death in the U.S. In an effort to educate the public, September is National Prostate Cancer Awareness Month. I'm Jodina St. John. This is Presenting San Diego, and today we're joined by Dr. Edward Cohen of Genesis Healthcare Partners to discuss what you need to know about prostate cancer. Dr. Cohen, thank you for joining us.
Glad to be here.
At what age should men start the discussion about screening and prostate cancer with their physician?
That's an interesting question, because if you have no risk factors, you should start at age 50. But if you have risk factors such as positive family history, a brother, a father, a grandfather, uncle, or you're African American, you really should start looking to screen at the age of 40.
If you are diagnosed, and there's been a lot of talk about this in the past couple of weeks, what are your thoughts on this watch and wait kind of approach?
Oh, active surveillance is really an important way of handling prostate cancer now. 25 years ago, everybody who was diagnosed with prostate cancer got treated. And though we decreased the death rate of prostate cancer over the next 20 years, what we did is overtreat a lot of people, cured a lot of people probably that didn't need to be cured. So what we want to do now is identify patients with prostate cancer, but not treat everybody. So fully 30 to 40% of the patients that we now see, that I now see, go on active surveillance, a form of watching patients closely, following their blood test, their PSA test, repeating biopsies as needed, doing imaging studies that are needed, and deciding when the right time to treat is. In some cases, it's never.
What if there does come a point, however, that the cancer has spread? And
well, we want to get it before it spreads. The idea of active surveillance is to get there before it spreads. But if it does start to get active, we can intervene with surgery or radiation therapy to initially treat the tumor. If the cancer does spread, nowadays we have a lot of advanced treatments for prostate cancer, something we didn't have years ago. Used to be that all we could do for advanced prostate cancer that had spread was hormonal therapy. Now we've got some novel treatments, including immunotherapy, advanced hormonal therapies, that have been very effective at treating prostate cancer for people with metastatic disease.
Tell us about Genesis Healthcare. What's going on there? Genesis
Healthcare is a group of physicians made up of urologists, radiation oncologists, and now gastroenterologists that services San Diego County. We have over 30 providers in our group, and we service the entire San Diego County from South Bay all the way up to Escondido.
Some people say it's more difficult to get men into a doctor's appointment. Is that true?
I'm sure it is. Men are worried, they're afraid, they're scared of what they're going to find out. What they need to know is knowledge is far more important. Knowing that you have prostate cancer puts you in a position of power to decide on how to manage it.
And that's where the screening comes in. It's so important to know what's going on.
Yes.
A lot of good things going on with Genesis Healthcare, too.
There are.
Dr. Cohen, thank you so much for joining us today. And if you'd like more information, you can go to our website, cw6sandiego.com, and we will be right back with more CW6 News at 4.